Hello everybody. Okay, so as promised, this video is about my surgery and the events that went around my surgery. So while they were making investigations about my first of all, please, if you've not followed me, please follow me. Please subscribe to my channel. And I'm just using the time that I'm making my kids juices and their lunch for school to make this video. So as at the time that they were doing all the investigations, that's when I say investigations, I mean tests for to find out what stage of the cancer I was at, like where the cancer has gotten to and all those things. Had it spread to my lymph nodes, and all of that. One of the tests that they did was a genetic testing to find out whether it's in my gene. I got the cancer due to my genes from a parent or from an ancestor, a forebear. So they did the testing. It took some time to come out, and then it came out positive that I had the BRCA. It's called BRCA gene, and BRCA gene basically means that you're prone to getting breast cancer and ovarian cancer. You know, so the day they called me, I was like, to tell me that my test results were positive for the BRCA gene. I think it was more of a mixed feelings for me. Yes, I was crying and all of that, but it was more of a mixed feeling because I was always asking myself, God, what did I do wrong to be given this kind of heavy load to carry, to be diagnosed with cancer at such a young age? I'm not saying that any age is good, really, but it was basically like I was handed a death sentence, you know, at 34. So I felt mixed feelings, relief and all of that. So the doctors, when I now had my consultation, because that phone call to tell me the test results was, like I said, it was a phone call, because they told me that if it's negative, I'll just get a packet in the mail. But if it's positive, they'll call me and talk to me about it and what my options are. So they also asked me to convey the message to my siblings and my parents so that they could also have genetic testing, or they could come in for genetic testing, but they are not all in Canada. So after that, when I saw the doctor, when I saw my oncologists and my surgeons, they told me that it would be better for me to have a mastectomy. One, because of the gene, and two, because of the gene again. Because, okay, let me backtrack. They told me that it would be better for me to have not a single mastectomy because the lump was in my right breast. But they told me I will have a double mastectomy, but it's up to me anyway. They're just going to give me their recommendation that it was better for me to take off the two breasts, because even after I've gone through the chemotherapy and everything I had to do for cancer to get myself to this level, chances of it recurring in my left breast is very high. You know, so I was crying. It was just a very huge emotional roller coaster for me, because as we all know, part of a woman's identity are boobs. You know, so I could not fathom it, but I just shelved the thought away because I was still dealing with chemo at the time. So I did not want to burden myself with so much. But after chemo, I was told 6 weeks between the end of chemo and 6 weeks after the end of chemo, between 4 weeks to 6 weeks after the end of my chemo, that's when my surgery would happen. So like I said, I focused on my chemo, did everything I could to get better with the help of my husband, my children, my friends, my family, my church, you know. So as the day for the surgery was getting nearer, I now began to be very frantic. I began to be very frantic about it, because I was just scared. At the point, the week before the surgery, I was crying non-stop. I was asking my husband if, was this the way that Jesus Christ felt when he knew that he was going to die? You know, like, is that why he asked God to take away the cup from him, this cup? Because that's how I felt. I felt so bad. You know, I was getting encouragement, but I could not shake it. I could not shake up that feeling of sadness. The day before the surgery, I could not eat. I was still crying. My husband even took me out, because we went to go and run tests in the hospital. After the tests, he took me out to go and grab a bite, but nothing could pass through my throat. I was crying. Then my elder sister, Dr. Tina, called me and she said, "Lindus, are you still crying?" I said, "Yes, I'm still crying." She now said, "Please stop crying. If not, you might have complications, because it's not about your physical state alone, it's also about your emotional states. You might have complications during surgery. Think about your children. You've been thinking about them throughout this journey, so think about them, and so that you just stop crying. Is it not better for you to be without breasts and alive than to be with breasts and enter the grave? Is it not better for you, Lindus?" So immediately she told me about the children. She brought them back to my forefront, because they were the reasons why I was fighting anyway. I just stopped crying, you know, came back home, rested, did all my sugar scrub and everything on my skin, because I did not know when next I'll be able to have a shower after surgery. Prayed, took photos of my boobs and all, videos, everything, you know, before they would go off. And then the very next morning, we were on our way to the hospital, because they told us to be there by 5:30. We got there, we checked in, I changed into my surgical attire. Shortly before the surgery, they came and wheeled me to the operating area, took me into a room, did some markings on my body, and then I was taken into surgery. My surgery lasted about 4 hours. Here in Canada, things are different from how it runs in Nigeria, because in Nigeria, you would like be given antibiotics. You will not even be discharged the same day. But here in Canada, I was not given any antibiotics. I was just given painkillers and told to go home that day. But after the surgery, when I was wheeled out, when I came to, like after the anesthesia wore off, I started feeling ill. My BP rose. I was having a temperature, because I got up. I said I wanted to go use the bathroom. They helped me to get up and took me to the washroom. It was like I was going to pass out. I was going to faint. So when I came out, I told them I was feeling feverish. Immediately, they just plugged different machines to my body. I started putting a warm compress and warm compress at the back of my neck, a cold compress here, and injecting things inside my body. So after some time, my BP came down, and they just told me to relax until I feel like, okay, I'm okay enough to like leave, you know. So after some time, they came and told me to sit up if I could, did some kind of like little exercises, you know, and then told me that I should try to move my arms. And that was another thing I was told to me during radiation. So I should try to move my arm, no matter how painful it is, because we don't know how connected our bodies are until you're forced into this kind of situation. So imagine them taking out your 2 breasts and then being told to move your arms, because your body is connected. I could not even get up from the bed on my own without help. I could not even lift my 2 legs up, like off the bed, and sit up without help. I had to be wearing a mastectomy pillow. Like I said, I will take my time and put all those things I use in the PDF that you can like download and see, this is what I use. I had a mastectomy pillow that I had to wear in the car, so that when a seat dog is across me, I will not be hurting. I came back home with 2 drains in my sides, like drains. I was giving drain cups to be measuring the drain, like the fluids that come out every how many hours, and I'll write it in the paper. Then when it was less than 30 ml in 24 hours consecutively for about 2-3 days, I could come and take out the drains. What else? So it was a lot. So by the time I got home, okay, so a friend of mine, man, like, thank you very much, God bless you for me. She came with my husband to the hospital. She helped me to the car. By the time I got home, my friend Laifa was waiting for me. Thank you very much, Laifa. You've been a like rock to me. She was here. She came from work straight to wait for me, and then helped me up. Madam Franca, thank you very much. Auntie Ronke, thank you very much. Adenike, that flew all the way from Toronto to and Mama just to come and see me after my surgery. Thank you very much. I don't take people's support for granted. So they all came, and then everybody was helping. It was round the clock helping. Some people were cooking, supporting my husband. Some people were helping me. I could not do anything. I could not even wipe myself because the pain was too much. But for every time I had to get up from that bed, because I remember what they told me, move your arms. If not, your arms are going to be stuck by your side. I'll be moving my arms with so much pain, and I'll be declaring, this cancer will not end me. This cancer will not break me. I shall live for my children. God, you promised to restore me to total health. According to your word in Psalm 41 verse 3, I was just basically declaring. All of them will be looking at me. They'll say, this Linda, you're strong. But for me, it was not a case of strength. It was a case of I need to get better for my children, because I'm the only mother that they will ever have. So, give or take, within about a week or 2, I don't really remember the timeline anymore. This surgery happened on the 31st of August 2023. Within about a week or 2, that's when it was not 2 weeks, that's when I took out my drains, but till now I still feel some aches and pains here. So the plan is for me to do reconstruction, but about the reconstruction, I'm still thinking about what exactly I want to do, because I've been told to put silicone, which I don't want to do. I've been also told that there's another one that they will do for me, like surgery, like reconstruction to take out fat from my tummy and put in my boobs. But they said that will take multiple surgeries, and I don't want that either. The last option is for me to bring down my BMI and then do the surgery once and for all. Take fat from either my tummy or my laps or somewhere and put it in my breast, which is what I'm currently working towards, to bring down my BMI. And then so that I can do that surgery once and for all. They said it's going to be a 12-hour or a 16-hour surgery, which is a very long time, So I don't know. Well, that is what life has dealt. That's the hand that life has dealt me, and I'm just trying to make the best out of it. So that's how my surgery went. So if you're wondering, yes, these are inserts. Yes, I had a double mastectomy, like I said. These are inserts. If you see some of my videos, you will notice that it's not as bulky as this. So, like I said, I went through hell and back last year. 2023 was one of the darkest years of my life. And that was going from someone that was always healthy and not falling sick to all the way to all of these things, like losing my boobs, losing my brother, like a lot of things happened to me, but I thank God that I'm alive. I'm sure some of you are wondering, why am I juicing the oranges with the bark on it. It's just because the bark contains essential oils that are actually very healthy for your system. That is why I'm juicing it with the bark. Even when I juice my lemons, I juice it with the bark. When I juice my ginger, I juice it with the bark. It's not everything that I juice with the bark, but this particular fruit, I actually do juice it with the bark. Anyway, so that's it about my surgery. And please remember, whatever it is I'm telling you, if I create that ebook and whatever it is, please remember that I'm not a medical professional. I'm only just sharing my experiences of how my life went with cancer and trying to give hope. I've talked to a couple of people that have come to me to ask like to ask for my experiences, and I try to like talk to as many people as possible. I might not be as responsive, you know. It's not because I don't want to respond, it's just because I also have too many things going on for me. Like you can see me now, I'm already dressed for work. I've just not worn my shoes and carried my bag yet. And so I have to settle my kids. I have to settle myself. I have to juggle a lot of balls. So that's why these videos are not coming out as fast as I would want them to come out. But please bear with me and please support me. Like, share, subscribe, ask me questions. I'm willing to answer any of your questions. I'm an open book. I don't like, because I believe that people that are going through these things, not too many people have people to talk to about it. And I was also thinking about setting up a group, but where do I set up this group? Will it be on Telegram? Will it be on Facebook? I don't know. So that we can support one another, because not everybody has that support. Not everybody can ask questions, and sometimes if you go to some certain groups on Facebook, they are white, you know, they are not people of color like you and I. So that's why I'm doing all these things, so that you can know that, okay, someone like you has gone through it. If you're going through it, you'll be fine. Yes, I'm still experiencing side effects, but like I said, I'm alive and I'm healthy, and we thank God for everything. So thank you very much for watching. Thank you for your support, and God bless you. Amen.